Assalamu alaikum everyone. I'm Dr. Waseem. Today's class is on risk factors of non-communicable diseases. Learning objectives. I will be discussing the topic under the following headings. First, characteristics of NCDs, predisposing factors for NCDs, NCD services in health system, prevention of NCDs, and at the end, MCQs on that topic. What are non-communicable diseases? They are also known as chronic diseases, and they tend to be of long duration and are the result of a combination of genetic, physiological, environmental, and behavioral factors. The main types of NCDs are cardiovascular diseases like heart attacks and stroke, cancers, chronic respiratory diseases such as chronic obstructive pulmonary diseases, asthma, and diabetes. A brief about global scenario and Indian scenario. Non-communicable diseases kill approximately 41 million people each year worldwide. That is 71% of global deaths are due to non-communicable disease, among which cardiovascular disease account for 17 million deaths, diabetes 1.3 million deaths, cancer 7.6 million deaths, and chronic respiratory disease 4.2 million deaths. Nearly 80% of NCDs deaths occur in low and middle income countries. In India alone, nearly 5.8 million people die each year from NCD. The definition of these chronic diseases, or we can say non-communicable. The Commission on Chronic Illness in USA has defined chronic disease as comprising all impairments or deviations from normal which have one or more of the following characteristics. These are the characteristics. Non-communicable diseases are usually permanent. They leave residual disability. They are caused by non-reversible pathological alterations. They require special training of the patient for rehabilitation, may be expected to require a long period of supervision, observation, or care. Gaps in natural history. The absence of a known agent makes both diagnosis and specific prevention difficult. Multifactorial causation. Most chronic diseases are the result of multiple causes. Rarely there is a simple one-to-one cause, effect, or relationship. Long latent period. Understanding of the natural history of chronic disease is the long latent period between the first exposure to suspected cause and the eventual development of disease. Indefinite onset. Most chronic diseases are slow in onset and development, and the distinction between diseased and non-diseased status may be difficult to establish. What are the predisposing factors for these non-communicable diseases? Usually occur between 50 to 60 years of age, and in fact they are more among men than women. Family history, it has been seen to run in families, and also there are genetic factors. Now the modifiable risk factors for NCD. Behavioral risk factors, they are tobacco use, unhealthy diet, alcohol, physical inactivity. Physiological risk factors. Raised BP, high BMI, dyslipidemia, raised blood glucose, and at the end we have cardiovascular diseases, cancers, COPD, diabetes, and all. As you can see, we have 387 million people living worldwide with diabetes, and in 2035 we are expecting more than half billion cases. So, what are the ways to prevent or delay type 2 diabetes? Are like, as you can see, exercise, eat healthy, manage your weight. These are some preventive measures. Similarly, we can have worldwide we have 14.1 million new cases of cancer who are diagnosed each year. Uh, 57 or 8 million are in less developed countries. In these regions, the most common types are lung cancers, breast cancer, stomach cancer, liver cancer, or colorectal carcinoma. This is the non-communicable servicing health system and their referrals. As we can say, the first contact between health and the community is sub-center. So at sub-center, we do screening services. After that, there is community health center where we have NCD clinics, geriatric clinics, where health promotion, early diagnosis and management, and lab institutions are done. After that, we have district hospitals where we have NCD clinics, geriatric clinics, cardiac care units, cancer care facilities, and at the end we have tertiary level institutes like medical colleges, tertiary cancer centers, regional geriatric centers, and centers of excellence where we have tertiary care training, research. Now the prevention part. In prevention, we have a national program for non-communicable diseases, which is called National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Disease, and Stroke. In order to prevent and control major NCDs, the National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Disease, and Stroke was launched in 2010 with focus on strengthening the infrastructure, human resource development, health promotion, and early diagnosis and management of the cases. And we have the referral system also. Under this program, non-communicable cells are being established at national, state, and district levels for program management. And these NCD clinics are being set up at district and community health center levels to provide services for early diagnosis, treatment, and follow-up for common NCD. Provision has been made under the program to provide free diagnostic facilities and drugs for patients attending these NCD clinics. As the slide shows, here a diagram is shown of a tree which has roots, trunk, and branches. If we consider the branches as non-communicable diseases like cancer, cardiovascular disease, chronic lung disease, or diabetes, so it will be rightly said that hit that root and trunk, branches will fall automatically. So we should take care of our weight, avoid smoking, avoid taking alcohol, eat a healthy diet, and be involved in some physical activities also, so that our weight is maintained. Now we have a few MCQs on the topic so that you can assess your knowledge. Kindly go through these MCQs. This is the answer. Thank you for watching the video.